A person is not a blood pressure number. A person is not a glucose number. It's all the other things that happen with that individual, their activity and behaviors. Are they eating? Are they bathing? Are they sleeping? All those things that we used to watch about each other if we were living together, they make up a significant portion of that person. So our approach was to take these two things, physiological signal monitoring, AI curated, activity and behavior signals, put them together to come up with new digital biomarkers for urinary tract infections, depression, fall risk, and nutrition risk. Thank you. Good afternoon, everyone. I created CarePredict because I'm the caregiver for my 93-year-old dad. And I used to talk to them every day and visit them on a weekend. And I would find new and interesting things that I had no awareness of that either caused me to take them to the ER that very day or specialist appointments the following week. And this unpredictability in their health was just causing havoc in my life. And I found that I was not alone. For the very first time in human history, we have the largest cohort of humans still taking care of parents while also taking care of children. And I figured that with all of my experience, I should be able to do something that can affect this problem of not knowing how things are going until you show up in person. I've been in technology now for about 35 years, and 28 of those have been in healthcare technology. And here at CarePredict, I'm joined by Greg from Baxter, Richard from Nuance, and Jerry from Wiseware, the very first connected jewelry for seniors. Small team, but a very effective team with lots of awards. So the problem that I had with my parents is really, it's widespread because there is a huge reliance on human observation and aging care. And this is because as human beings, we are wired, whether we used to live in the trees or below the trees, to always have eyes on each other. That's how we know when something is going wrong. Whether it's for our own parents or children, we constantly look at them. And if something changes, we ask what's going on. And that's how we know. That's no longer possible because families are geographically dispersed, the aging are living longer. And the number of family caregivers is dropping because as developed nations, our population growth is receding, and we don't have enough family members even to care for the aging. Also, and the same goes towards paid caregivers as well. So in general, the reliance on human observation is not going to scale planet-wide, period. So we came at it with a completely different perspective and said, well, if the current standard of care in senior care is just remote patient monitoring their blood pressures, vitals, and things like that, and really only looking at their chronic conditions and modulating their medications to manage their chronic conditions, that's only looking at maybe 5% of that individual. A person is not a blood pressure number. A person is not a glucose number. It's all the other things that happen with that individual, their activity and behaviors. Are they eating? Are they bathing? Are they sleeping? All those things that we used to watch about each other if we were living together, they make up a significant portion of that person. So our approach was to take these two things, physiological signal monitoring, AI curated, activity and behavior signals, put them together to come up with new digital biomarkers for urinary tract infections, depression, fall risk, and nutrition risk. And what we learned was that these AI curated digital biomarkers are predictive as well. So for example, with urinary tract infection, one of the costliest things that can happen to a person in the United States, that's because they're never caught in the first 24 to 36 hours when they could be solved with a very easy oral antibiotic. They're almost always caught 3-4 days later when they're septic and need IV-infused antibiotics. Now, the thing is, if you had a person living there 24/7, they would have noticed unusual bathroom visit duration and frequency, and they would have commented on that, and they would have figured out that there's a UTI brewing. Well, since we don't have that human observation, that's one of the reasons why we have UTIs being caught very late. So we built technology that's a wearable device, goes on the wrist of the dominant arm, has AI and machine learning in it, and it can detect things like eating, bathing, cooking. And when we say it can detect eating, it actually measures the fork going from the plate to the mouth down to that granularity. It also tracks all their location as well. So it does all of the things that we would normally do if we had a human observer in place watching a person. And it compiles all these activity and behavior signals into a baseline over a rolling 14-day period and looks for anomalies to alert the family caregivers as well as professional caregivers that something is going wrong. And that's kind of what we put together to drive that preventive intervention. Today, we are in 8,000 subscribers, seniors at 80 facilities in the United States. We have a nascent footprint in Japan and Canada. And we are post-Series B, we're in the middle of our race. We're going more into the aging in place market as well. We've already started with several home care franchisees, Right at Home, Bright Star, and others are already using our product today in the market. We have the results to show for it. This is a 24-month peer-reviewed published study that showed in a cohort of 500 people in 6 communities that we lowered hospitalization by 39% and fall rates by 69%. We're also going into Medicare Advantage, and we've started those conversations. Our timelines, you can see on the screen that we're getting into care management this year, and we'll get into the supplemental benefit side next year, doing the pilot programs, and then into planning year 2024. So the way we look at ourselves, we're a wearable that's on the wrist of an aging senior. That's the most valuable real estate on the planet. And we are going to be that health hub that they will access all of health through. We already have Care Voice, the voice of a grandchild coming out of our device, telling grandma to take her medicines. We have our health nudges coming out, telling somebody with COPD that you need 2 more minutes on your feet today so you can reduce your exacerbation of COPD. We have our care guide coming out this month, which allows Omron devices to directly pair with our wearable device, blood pressure and all of those things, to go directly into our device to be enunciated and go as part of our data stream back to our population health dashboards. And we are going more into a clinical crossover with automated supervised assessment, unsupervised assessments, as well as detecting MCI and things like that. So we are raising a Series B to support the demand and expand our markets. We are forecasting a year-end ARR outlook for 2024 of about 50 million. We raised 24 million to date, and we have 22 issued patents in the company. And SV Health Investors is one of our larger medtech investors that's also participating in our Series B. So I would love to connect with anyone that would be interested in either partnering with us or investing in us. Thank you.
One question that came up in the chat is interesting around seniors with dementia. Are there any product adjustments that can be made for those folks?
Yeah, that's a great question. We're already in independent living, assisted living, and memory care units in the United States. So we're already on dementia patients' hands today. We had to adjust some things in there. So we had to make it so it could not be removed. Accidentally, it needs a staff member to remove it. You have to do things like that. There's a little population in dementia, once they get into that paranoia and schizophrenia stage, that they're not going to tolerate anything on their wrist. So there will be people that will never use us, but that's a very small fraction. We have about 85% adherence rate in memory care units today among our 8,000 subscribers, and we have about a 96% adherence rate in independent living and assisted living.
That's another question I had was around the adoption and kind of the experience there with the patients and the users. How do you handle those objections around maybe privacy issues or a feeling of big brother watching? What has that experience been like?
Yeah, that's a great question. When we first started, I was very apprehensive that that would be a big issue. But what we learned is that these are very frail elders that are in these senior living communities today. They're there for a reason. They're there because they need assistance in intimate personal activities by strangers. The care staff is, helping them go to the toilet, cleaning up, and doing all of those things for them. That expectation of privacy is not there in our current population. As we move more into the aging in place, we had to do several social engineering type things to make it useful for the individual. For example, to have the grandchild's voice coming out of there and kind of strengthen those family bonds and things like that, and the reminders and the care guide and things like that, to really kind of make people feel, look, it's not about, privacy and all of that. It's about, I want to live longer. And by the way, I'm hearing my grandkids' voice coming through this thing all the time. It's a constant reminder to them that there is somebody there that they're living for. And those are the kind of social engineering things we had to do to really improve adherence, even for those aging in place at home.